everyone, I'm Katie and I'm here today to talk to you about SPD. And if you're not sure what it is or if you're wondering if you have it, let me explain it pretty simply. You've got your pubic bones that come through the front, just like that, and they are supposed to be perfectly aligned and balanced with each other. Well, what happens with the hormones in pregnancy is everything starts to loosen up and you get more of a separation right there. With that separation leads to the possibility that one side might come out of alignment with the other. And when that happens, the soft tissue right here, it's like you're taking a washcloth and wringing it. It is very painful and you will feel it when you're walking or moving, especially if you're jumping or running. That will really let you feel it right away. And usually it's pain on one side or the other, but right up here in the front on the pubic bones. So if you are experiencing that, just know it is unfortunately very common in pregnancy and there is help. Now this is going to be our third boy that we're expecting. I'm in my third trimester and I am walking and moving pretty much pain-free most days, and that was just a dream with my first and second pregnancy. My first pregnancy, it was pretty bad. And my second pregnancy, it got even worse, to the point where I was sitting around a lot more than I wanted to. And I wanted to be up and moving and keeping myself physically fit, and I couldn't because of the pain. And I thought that's probably what's going to happen with this pregnancy, and it hasn't. So I want to share with you the tips and tricks that I've learned along the way, the things that you can do to make your life so much better and your pregnancy so much more enjoyable and pain-free. Now, all of us love to have tools handy, things that are kind of almost a quick fix or a crutch that we can use, and let's go over some of those and why some are great and some may not be so great. So the first one you're going to hear a lot from even just your doctor or your midwife is they'll offer you a support belt, or they'll ask you to check out a support belt. Support belts come in many sizes and styles. There are ones that'll even hold up your whole belly to pull weight off of the hip bones. And these can be fantastic. And they can also be horrible. And what I mean by that is the belt will provide support all the way around, and it also is going to provide kind of a compression pressure to you. And if that pressure does not work with your misalignment, you will find yourself in more pain trying to wear one of those than in less pain. So my recommendation is find somebody that has one that you can borrow just for a day, go through your normal daily activities and find out, did you get relief or nothing at all, or is it even worse? You want to know about that before you invest in one or before you ask your insurance for one. Another tool that I would recommend for everybody, especially since you will hear about this in spinning babies as well, is the tilt of your body when you are seated. So if you look at most chairs, they are either completely level with the ground or they actually tilt backwards. And bucket seats in cars are horrible for this. They will tilt you backwards. That puts a lot of pressure with your leg upward on baby and on you, and it is definitely not good for SPD as well.
To get into a higher vehicle, keep your legs together as much as possible so things stay nice and balanced. You can watch your abdominal muscles as you tighten. Make sure there's no coning shape happening. If you need to reposition or even pull your legs up with your arms, that can be helpful.
So I take this cushion with me everywhere. When I sit down to eat with my family, I use this. When I go driving, I use this. If I'm going into a place that I'm not familiar with, how their chairs are, I bring it with me. So this is definitely a tool I would recommend for everybody, and I would say is universally good. Two other things that you want to do that are not necessarily tools, this is physical tools, but things that you should do absolutely is 1, chiropractic, and 2, physical therapy. I would not choose one or the other. I would choose both and combine them most definitely, because your chiropractor is going to be able to bring mobility back. They'll be able to reset things all that works fantastically. That's wonderful for healing. You want the movement through there, and you definitely want a chiropractic that is familiar with the Webster technique. If you are not balanced and you go through pregnancy, you're going to have pain. If you go through labor and vaginal delivery, you can actually have complications that'll make it harder on you and harder on your baby, and can actually be, some of them, very dangerous if there's a misalignment and the baby can't get through the birth canal like your baby is supposed to. So you definitely want to have a chiropractor on your team if you're experiencing any discomfort at all throughout your back, your hips, and your pelvic area. And I would go to one just in case, even if everything's a breeze during your 3rd trimester, to have them check and make sure everything is ready for labor and delivery. Now, the reason we want to combine this with the physical therapy is your chiropractor will be able to align you, but you've got muscles that are holding you out of alignment. So I can have my chiropractor knock this back into alignment. I feel great for a while, and it's going to slowly come back out, or suddenly if I do something I'm not supposed to. So you need physical therapy to locate the muscles that are too tight and to help loosen them up, and find the muscles that are too loose and weak and start strength training those so that your body can start helping itself to stay in the correct position. And ultimately, that's going to save you a lot of time, money, and give you a lot more relief as well. So combining the two is absolutely ideal. And now let's get to some things that you can do yourself at home. The first thing I want you to do, and you can lean up against the wall if this helps you to visualize and see with a straight line, but I want you to do something called dancer's posture, and make sure you have this throughout the day, whether you're sitting or standing up. And the first thing that you want to do is roll your shoulders back and lift up that breastbone up to the sky. And what this is going to do is going to give your lungs a lot more room, and it's going to give baby a lot more room as well. When your baby is correctly positioned, you're going to have a lot more comfort and balance down here as well. So roll those shoulders back. And the next thing I want you to do is called a pelvic tilt. So you have your legs about hip distance apart, and your spine comes in the S curve, and we don't want to duck butt out. That's going to cause a lot of problems and discomfort. So just my pelvis, I'm going to tuck that tailbone in and under. So if you can see that, it's going to be, you're almost lifting up here as you tuck there, that slight rotation. One more time. So shoulders back, slight rotation. And when you do that, you will get a natural bend in your knees, which is also very beneficial because you do not want to be locking your knees at all. It gives you, when you have slightly bent knees, a little bit more cushion down below so that your pelvic bones aren't taking the brunt of the force with every step. Do not feel bad if you have SPD, if you have to give up jogging and running and some other activities. They are not beneficial for you. Don't feel bad about having to put them on the back burner until after pregnancy. Because if you do any exercises, and this is going to be a big do not, if you do any exercises, do not do exercises that put pressure on one side or the other, unbalanced, especially any weight-bearing exercises. So if I'm running, I'm giving a sudden jolt to this side of my pelvis, and that's going to shock everything and pull it out of place very quickly. So that's absolutely a no-no. And think about that too with pregnancy yoga. There's a lot of prenatal yogas that are wonderful, but if they have exercises that are unbalanced, even when you're on your hands and knees, if you're lifting up one leg and not the other, you probably will want to avoid those unless your physical therapist tells you you're ready to start incorporating those again, because otherwise they're going to pull everything out of alignment. And for those of you that are familiar with belly dance, I'm going to show you a couple things that you can do while you have SPD that'll really, really help. But two things I want to talk about are chakras. And chakra points, you have chakra points throughout your body going up. You've probably seen them with the rainbow color starting from red and going on up. You've got your root chakra down here and your sacral chakra, which is a little bit up. So we're going to be focusing on both of those when we do a lot of our exercises. Most of us are familiar with the root chakra because we have to utilize that to do Kegel exercises. So you tighten down there. But what I want you to do is to tighten up further through here. You want to have all of that tight. And if you incorporate a little bit of that pelvic tilt, that really, really helps. So depending on what I'm doing, if I'm getting up, lying down, doing my exercises, usually that tightening works best with an exhale. And your inhale, you relax. So when I'm getting ready to do something, I exhale and tighten all that up, just down there, okay? And then inhale, let it relax, okay? So practice that a couple times and get used to it, what it feels like, and that'll really help you utilize those muscles down there. That's gonna bring a lot of stability to you. Some things that can undermine that stability is coughing and sneezing. So if you feel a cough or sneeze coming on, automatically tighten up, get ready for it, and hold it through the cough or the sneeze. You will find it a lot better and a lot less jarring to the rest of your abdominal muscles. Another thing that you want to focus on is to make sure that when you walk, you aren't waddling. It is very tempting to waddle, especially as you get bigger. That is going to throw your gait off and ruin your stability. Make sure that you have really good footwear. This is a fantastic investment. And even if this is going to be your last baby, you want to have good footwear. Definitely no heels. You want something nice and flat with a lot of good cushion to it. Now, before I go into some really fantastic exercises to really help you bring stability and keep it to these pubic bones, I want to show you one other technique. This technique is going to mostly apply when you're lying down and getting up out of bed or getting on and off a chiropractic table or a physical therapy table. So you want to be able to lay down and get up properly. So what I would do when I'm laying down is I'm not going to just sit and then lean myself backwards. That's going to put a tremendous amount of pull on my abdominal muscles. The same when I get up. I'm going to come down onto a lying position on my side. Just like this. And then carefully position myself onto my back with my knees bent or straight, whichever is comfortable for you. Laying on your back for an extended period of time when you're in your third trimester is generally discouraged, and you can gauge that for yourself, how your comfort level is. If it's going to be something that's not good for you, you're going to start getting lightheaded. So if that happens, you can prop your head up with a pillow or ask to be moved into a different position. Now, the tempting thing when you get back up is a lot of people are so sweet and they'll offer you their hand so you can pull yourself up. Decline the hand, or you can do a modified version of that and grab their hand and then turn yourself to your side. Again, we want to make sure that we're engaging these muscles here. So exhale, tighten, and then slowly position yourself up, or with a hand like this, use this hand to position yourself up. Whichever is most comfortable for you. Don't be afraid to tell somebody, I'm sorry, I need to do this. I can't grab your hand right now. This is about you and your baby. You don't have to make other people feel fantastic. Even if they're well-meaning, let them know your needs. So everything we're doing today, I want to remind you to tighten the root and the sacral chakra as we move into each new position. So laying down and getting back up, you want to make sure that those are engaged. And how to know that you are doing this correctly is keep an eye on your abdominal muscles. If you notice that instead of a nice soft dome, you are getting a coning position where your muscles are coming forward, it's not being done correctly and you're actually causing yourself injury. That's gonna weaken these muscles here and cause you a lot more pain. So keep an eye on that. If the coning starts, know that you're in a position that is not good. You either are not engaged these muscles, or you're pulling yourself in a position that your body should not be doing at this point forward. All right, so keep in mind any of these exercises that I'm showing you, you can do in the comfort of your own bedroom, on your own bed, absolutely. I am showing these to you on the floor because it's easier to see. So many of us are familiar with this position, especially if we've done any yoga classes, the cat and the cow. We're not going to be doing the full range of motion with that because if you let your back concave in anymore, with your tailbone sticking up to the sky, that can actually injure your back because you already have a lot of pull through here. So we're going to come as flat as possible. And for the first few tries, just tighten up the root and the sacral chakra as you're breathing. So exhale, tighten. Inhale, loosen. And you see that my back doesn't move at all. I'm just tightening those abdominal muscles. My hands and my knees are shoulder and hip width apart, perfectly balanced. So try this a couple times and see how that works. And if you'd like to add a little bit more, as you pull in, you can round up a little bit to ease some of that pressure on your spine, and then come back to perfectly flat neutral. Never go down further. So now I'm going to show you the laying down thigh squeeze that most of us who've experienced SPD may already be familiar with. So you are flat on your back or your head's up a little bit if necessary. You want to make sure your feet are closer in rather than further away. So right about there, get in a place that's comfortable for you. You want to make sure that you don't have that space right here. So again, tighten up those muscles. And you can have somebody assist you, or you can use your own tool, like a cushion, or a soft ball like this between your knees. Now you want to tighten up these muscles and squeeze to the count of 3. And then inhale and relax. Squeeze to the point of your comfort level. And do this 3 times. So a lot of times I'll put my hands here to make sure that those stomach muscles are engaged each time. One more time. And then release. And what that does is you can sometimes actually reset the pubic bones where they are supposed to be with this exercise. Now we can also get a little bit more advanced with our squeeze. I'm going to put a pillow in between there, my hands flat down here. Remember to engage as we exhale, and we're going to do a bridge as high up as you are comfortably able to do. So exhale, tighten. And inhale, relax back down. There's also a standing version of this exercise. And what I'm going to do is I'm going to come down into a squat with my back perfectly level, flattened up against the wall. And that'll help me maintain that pelvic tilt. Put a ball or pillow between my legs and squeeze. Inhale, relax. Remember to engage. Exhale, squeeze.
When you're out of alignment, here's a great exercise to reset. Which side you're having pain on, you want to bring that leg up towards you and put the opposing one further away, bracing it on your pad or in your bed against your sheets. Your opposing leg is going to push down and away from you, and the leg that's having trouble is going to push into your hands. And this can reset your pelvic area. Another way to reset is use a wall or a headboard as a guide for what a 90-degree angle looks like. Open your legs and close them about 3 times, and you may even hear a popping noise as things settle into the place that they're supposed to be.
Another thing I'd like to show you is proper stretching to get your muscles ready and limber to do some of these moves if they are really tight on one side or the other. So I'm going to lay down, come onto my back, and I'm going to put my foot right here on my knee and just give a gentle stretch as much as I'm comfortable with. I can bring my knee up higher if needed. I'm usually very loose on this side, so that's an easy stretch for me. This side, I'm very tight on, so this one benefits even more from the stretch. And what we want to do is get as even as possible mobility from one side to the other. Okay, some other things to help you stretch and loosen up. And your physical therapist will be able to show you a lot more, but I'm going to show you how to do a proper hip circle. And you can do this pretty much anywhere, standing with feet hip distance apart. And what I'm going to do is I'm going to be doing a circle with my hips only. Very small circles at first, very slow. And you can see how I'm keeping this part of my body completely straight. This part of my body is not circling. And you can go from one side to the other. So clockwise, counterclockwise, and you'll feel when you're doing this, if there's instability in your muscles, a pull on one side or the other. Today I'm feeling a pull right here. So I know I've got a tight muscle there that is not helping me. I'd really encourage you to stick with things like walking, swimming, yoga, prenatal yoga, that is balance, and also belly dancing. Belly dancing is absolutely fantastic, and it was actually created for pregnancy, labor, and delivery. Most of the core moves through belly dance are directly for that, for helping the mom get ready for and go through labor with as much comfort as possible and help push the baby out with a lot more ease for her. So when you were doing belly dancing, we talked about correct dancer's posture, shoulders back, the pelvic tilt, and we also went over the hip circles, clockwise and counterclockwise. One other movement that I'd like to go over is undulations. So that would be a lot of times the camel, where the dancer would put one foot forward and either go kind of at an angle to the right or the other foot forward and an angle at the left, and you can actually walk with this. If you have SPD, I would not recommend that at all. You want to be firmly planted, straight, not one foot in front of the other, and your undulations are going to be completely forward. So I'm going to show you that from the side. So what I'm going to do is I'm going to lead with my chest, and it's going to fall back through almost into a sitting position. And uncurl and repeat that process over and over. Do it as little movements as possible, but enough to know that you're actually getting the move. So you're going to be engaging these muscles. You're going to be maintaining a pelvic tilt through most of it. It feels really, really good for your lower back. And it helps the baby, even now, get into a good position and your abdominal muscles get strong enough and ready for labor. And while you are in labor, if you can do this movement at all, it'll help the baby move down through the birth canal a lot more easily. So you can watch more videos on that and see how to do undulations exactly. It's a little bit more difficult when your abdomen is way out there and you can't utilize muscles like you could before you were pregnant, but it works really, really well. And it's also very soothing for both you and baby. So just think right now, I'm rocking my baby, and I'm also doing a lot of work for me to help me get stronger and get a little of that back relief as well. Thank you again so much for watching. If this video was helpful for you, please give it a thumbs up, and also share it with your friends. Let them know that there is hope. They can get their mobility back, they can get their pain level down, and get through this pregnancy with a lot more comfort than they've had before.